Tonight, federal officials step up precautions across the country to prevent the spread of the Ebola virus on U.S. soil. This as Spain deals with its first case of the virus, and health officials also keeping a close eye on the entovirus, which has already spread across 43 states. Tonight, a doctor of internal medicine and infectious diseases, he joins us on set to answer your questions about both viruses. And infidelity and politics, nothing new there, but cheating certainly has ruined many a politician's career. Just ask Gary Hart and his chances of holding the nation's highest office. Would an act of infidelity cripple a run for the White House in 2014? Plus, Mayor de Blasio is standing firm backing Rachel Nordlinger among that inquiry into what she did not divulge about her ex-con boyfriend. Mayor says the media should back off and leave her family and personal affairs out of the press, but is Mr. de Blasio, of all people, being hypocritical here? After all, his family helped get him elected. Good evening, everybody, and welcome to RFL. I'm Richard French. Thanks so much for joining us. We're going to begin with the Ebola outbreak that is sweeping West Africa and making its way onto American soil. Now, Texas health officials say that Thomas Eric Duncan, the first person to be diagnosed with Ebola in the U.S., remains in critical condition. Duncan, he is on a ventilator and is receiving kidney dialysis. Authorities say he contracted the virus while visiting his home country of Liberia, and federal and local officials are monitoring nearly 50 people who came in contact with him or someone who he came into contact with. Meantime, an NBC video journalist, as you know, being treated for Ebola, that in Nebraska, receiving the same experimental drug being used to treat Duncan. Dr. Rick Sacra, an American aid worker, was also treated for Ebola at the same hospital in Nebraska. Now, the U.S., hardly the only Western country battling this virus. Health officials in Spain, they're working to contain the Ebola virus. 4 people being quarantined at a hospital in Madrid where a nursing assistant got infected. Authorities say it is the first case of Ebola that was transmitted outside of Africa. Doctors say there is only one way to stop the spread of the disease throughout the world.
The only way we're going to get to zero risk is by stopping it in Africa. That's where the battle has to be won.
Attacking it at its source. And medical officials in the U.S., they are retraining hospital staff, and the U.S. military, they're preparing to open a 25-bed hospital for healthcare workers with Ebola in Africa. It will then build 17 Ebola treatment units in Liberia. President Obama saying the U.S. airports, they will boost their screening of travelers who fly in from West Africa. Now, there is a local hook to this. Westchester County Executive Rob Astorino, who you know is running for governor in New York, he says screening, that's not going to cut it. Astorino said, quote, "We're being told by health experts that there will almost certainly be other Ebola victims arriving, yet air travel from countries in West Africa to New York continues with inadequate safeguards in place." He went on to say, "I therefore call on the FAA today to halt air travel to New York area airports till proper protocols are in place, protocols that can guarantee the safety of New Yorkers and other Americans." We'll get into politics somehow as it enters into this conversation, but so many of you have asked so many questions about this, and I keep telling you I don't even play a doctor on TV, but the questions are coming on a whole range of things. So we gathered some of the ones that seem most prevalent from you, and we're going to bring in our guest here to help answer some of them. Dr. Richard Klein, a practicing physician in Yorktown Heights, specializing in internal medicine and infectious diseases. Dr. Klein, also associate professor of medicine at the New York Medical College, and was knighted by the Italian government for his humanitarian work. Not bad.
Not bad.
All right. Let me ask you some of the questions. Let's start with Ebola, then we'll get to enterovirus in a second. First off, who's most at risk here when it's talking about Ebola?
Well, let me just say one thing first. Everything is in perspective. In the United States, 40,000 people die every year of influenza. 200 million people have the flu during the regular year. So if you're talking about a death rate of 40,000 people a year, you have to just realize that the rates of death of both the virus that you were talking about and Ebola is going to be very insignificant.
That said, and you know this perspective, and you're closer to this than I am dealing with infectious diseases, I've talked to a lot of people I even respect, who really believe that the CDC is not even shooting straight with us. You've heard some elected officials, even in Washington, say the same, that, hey, this virus is getting out ahead of us. They're trying to calm the nerves of the public, when in reality, they don't have their hands around it. So maybe we start there. From the CDC's perspective and the other officials on the state, even local levels, do they have their act together here? Or are we still playing catch up?
No, we're playing catch up. And we will catch up very soon. That guy that got sick on a plane in Newark, there was a picture of two policemen wearing a mask and gloves, and they were going to go talk to the patient who was vomiting. Obviously, if he had Ebola, they weren't dressed properly. I used to be the Hudson Valley quarantine officer. But I used to train people. We had the police department, the fire department, and the ambulances. Make believe a plane came in, and we were up to speed. These people are not up to speed. So from a political point of view, the president has to say that things are going well, otherwise the whole country would be going crazy. However, we are almost there.
All right, well, let's get to some of those questions I get all the time, and talking about who's most at risk here of contracting or getting the Ebola virus.
Just as it was announced before, it happens to be the people who live in the area. You know, Ebola is transmitted from bats. Bats eat fruit, fruit falls onto the floor, animals eat it, animals get sick, people touch dead animals and they get sick. So people who are most at risk, and that's why they're going to be building hospitals, you know, the clinics and hospitals that take care of the patients now, a lot of them don't have water. People go in there without hazmats and they're going to get sick. And most of the people getting sick happen to be medical workers.
Typical signs of infection, because you mentioned, for example, that scene that we saw where you got cops with rubber gloves and a mask going on a plane because the guy's getting sick. That first explain the common symptoms, but also how difficult it is to contract the virus from someone else, especially if we're not talking about people that are in West Africa or Liberia or the hotspots for this.
Well, the disease starts off as if you had influenza, but influenza with a big kick. You get fever, a cough, and all the different things that go along, but rapidly, and you become rapidly ill, and then you start getting the symptoms of vomiting, diarrhea, and about 5 days later you start bleeding, and that's one of the hemorrhagic diseases. You can't get sick if you just inhale air, so it's not transmitted by airborne. You can only get sick if you come in contact with body fluids. Not to say that it can't mutate and become airborne at some future point. So also the problem is that once you get sick, you have to wait about 5 days before you can do a test. Tests don't become positive until 5 days. No treatment. The only treatment is supportive. Unfortunately, these little villages in Africa don't have supportive therapy. They don't have IVs, and they don't have hazmat suits to keep it from going from one person to another.
I shared the comments with our audience from county executive and Republican candidate Rob Astorino on this. I've heard people saying that's the worst message to sound. You can't put up a wall and keep the infectious diseases from the United States. It doesn't work that way. Until we attack it at the source, we're not going to really deal with it. Is that right?
I 100% agree with that. Well, it's just interesting that people come up with all these political solutions when the source is over there. You have to treat the people, isolate them, and we will be getting people coming into this country who are sick, but not on massive scale, just as people are imagining. There aren't going to be that many people coming in sick, but there will be.
Let me get to enterovirus here. You got parents really across the country alert about enterovirus D68. Now, doctors say the infection can cause mild to severe respiratory illnesses. Centers for Disease Control and Prevention confirmed just under 600 cases of the virus in 43 states, including D.C. The virus claimed the life, as we know, of 4-year-old Eli Waller of New Jersey. Officials say the young boy passed away in his sleep after his parents kept him home from school thinking he may have pink eye. Now, since that's happened, we've got a lot of concerned parents right now. And first of all, we're talking about an outbreak here because we've seen other incidents in other states too. You look at the total, when you look at the map, you see all the states impacted, it jumps out at you. How do you quantify this?
Let me say that the enterovirus comes from a long line of mean viruses. polio is one of them, Coxsackie. They're really tough viruses to deal with. It's the most common form of aseptic meningitis. So you're dealing with a virus that doesn't really show up all the time. A couple of years ago, we had a little outbreak, and the year before. You're talking 500 people. Nobody wants to see 500 people get sick. And you're talking about 2 children who died. Nobody wants that either. 40,000 people die of influenza. Couple of 100,000, 2 million people, millions of people get the flu. And it's interesting, even if they came up with a influenza virus vaccine against the enteric virus, most people won't take it. But you're talking about small numbers.
You know what I can tell you has spooked some folks here, especially imagine the families in New Jersey where that poor boy died, was the rapidity, how fast it happened for that young boy. And medical professionals say right now, so many of these cases they'll mistake for the common flu. Is there a stronger strain of this? We know strains evolve. Yeah. Is that the concern in the medical community?
No, I think it's the same strain. It's just that every now and then you get hot spots where a couple of kids get it and they spread it very quickly. 500 people, the last big outbreak was about 300. But it's a tiny amount of people as compared to, as I said, influenza. And I just remember one story about influenza. A couple of years ago, I was offering the influenza vaccine to patients, and they all refused it. Then all of a sudden, news came out that there was a shortage. And
there was
these patients, there was a run. I said, what are you doing here? And they said, well, you can't get it. So.
Well, parents out there want to know what, if anything, can they do to either mitigate it or treat it. There's not this panacea for it, but what would you recommend to concerned parents out there?
Number one, you have to keep away from people who are sick. Number two, if people cough, they should really cough into their arms. And you should wash your hands because somebody could have coughed, left it on the doorknob. And so washing your hands very frequently is really important. It happens to 4 or 5-year-old children. Most of them have asthma or some underlying lung disease. So not that another child can get it, one can, but it's really unusual.
There was also the concern we've seen in certain cases, and I don't know if they've made the direct connection between the two. You mentioned polio, severe muscle weaknesses, near paralysis for some of these kids, albeit potentially temporarily. How is that connected to this, and how is that different maybe from prior strains?
This strain is the same as always been, and it does the same thing as it has done, just that we don't see it that often. And in about another month, it's going to be gone because it only flourishes in summer and early fall. So we won't be talking about that in a month.
I remember, I don't know, maybe it was 10 years ago, you probably remember, but remember when the bird flu was a big scare? And I've asked this to other medical professionals, but what shocked me the most of it was how few people were in on the plan. We talked about, remember, we were going to quarantine people in big stadiums. Well, some of the stadium operators was news to me. I never even heard that we were part of this plan. And then you have the people in the local levels that had to work in concert. The playbook wasn't shared, let's put it that way. How much progress has been made in the last 10 years, and how concerned should we be as a public that maybe not we're talking about Ebola or the enterovirus, but if there is, or when there is a pandemic, an epidemic that happens, that we in the States are truly prepared and coordinated to deal with it?
I think that we have a pretty good hold on it. The problem now with the Ebola is that most people were not prepared for it. They weren't ready. They didn't think that it was coming over here. And then when it did in Texas, they missed it. I mean, they sent the guy home from the hospital, and then he introduced the virus to about another 100 people. So once people are aware and educated, that's where we'll have a good handle on it.
So final thing here, I know we got to wrap, is the public, while concerned, they shouldn't be panicked.
Definitely not. And I blame the newspapers and media, especially for the enteric virus, because, it's like a tiny mini outbreak. And not that that belittles the fact that people can die from it, but it shouldn't be on everybody's mind they're going to die. People come in the office, do I have Ebola? And that shouldn't be.
Dr. Klein, I blame the media all the time, too. Thank you very much. Now, head over to Facebook and Twitter and sound off on our question today as to what you would like to know about Ebola or the enterovirus, and hopefully we've answered some of those questions. Now, we come back, I'll bring the panel in, take a look back at that Gary Hart scandal. Did it change American politics, as some recently have suggested? We'll pose that question to our panel and try and figure out where the line starts and stops in 2014 about what the public cares about and maybe it's just titillating about. We'll be right back. So it's